And the idea is that you would forge a stronger relationship with citizens and you would involve them more directly in government. Now, this focus on citizens emerges from a focus that we had in the 80s and 90s around the customer. This was largely driven by market-based reforms in Thatcher's Britain, Reagan's the United States, and more recently in John Howard's Australia. And the theme was that the public sector needed to adopt private sector approaches in dealing with their citizenry. This led to a greater focus on meeting the expectations of customers, and this kind of model emphasised choice, competition, contestability, and market testing as ways of achieving efficiencies. We've come a long way since then, and I think we've realised the limitations of these kinds of arrangements, not the least reason for which is that some of the people that, in fact, many of the people we deal with have no choice but to come to us to get their services. More recently, we've seen a considerable move in these areas, and I think Terry Moran has put it in a social exchange theory context, and he says, there are important elements such as a measure of shared responsibility for the well-being of all in our community and the social cohesion it promotes that are not readily tradable in the marketplace. The idea here is that a social exchange perspective would encourage public servants to think about their relations with the public in a different light, taking into account the less tangible benefits that they're able to contribute to the relationship, such as cooperation with government, compliance, or even co-production, rather than thinking only in terms of a homogenised group of recipients of transactional services, the nature of which were typically devised by governments. It's really a perspective that identifies that we're dealing with multiple publics, and we need to take account of those multiple publics when we're devising services. And I think what we're seeing increasingly is a move away from efficiency, but we're seeing that as the baseline of what we do, to a growth in a view about the effectiveness of service delivery reform. Now, for the human services portfolio, it's meant seeing ourselves a bit like an Amazon company. A large delivery system within which niche products not only exist, but piggyback on the system, enabling it to flourish. That means that we need to do our core transactional government business well and add on extra services and information in ways that are packaged to suit particular people's needs. The changing nature of this interaction between government and citizens the world over has given rise to a theoretical debate about the role of the state in modern society. For some commentators, a combination of socio-economic and political factors like privatisation, globalisation and the demand for government to respond to wicked problems, together with the growth of networks and IT systems across the world, has resulted in a weakening of the power and influence of governments. According to this school of thought, government has become just one of a multiplicity of actors and has undermined its ability to control the policy process. This is called the hollowing out of the state, denoting a shift from the traditional centralised focus of governments to more society-centred perspectives. Others argue that this kind of perspective is overstated or flawed, and some have taken the view that although governments are now demonstrably more likely to forge relationships with a larger range of non-state actors, they nevertheless remain the central players in governance arrangements. Indeed, they argue that governments have been strengthened through relationships that they develop. Now, I have to say I'm in the latter camp, but whatever position you take on this, a confrontational question flowing from the debate is whether genuine citizen or people-centred approaches can happen in the system. That is, can the public sector be the agent to develop the sort of community capacity required for real change, or does it actually need to step aside sometimes? Now, a quick history of these sorts of things, I think, reminds us that citizen-centred focus isn't a new development. Coombs, in fact, in his groundbreaking report in 1976, said that the public sector was less responsive to changing community needs than it should have been. That led to a number of important changes in public administration, and we've increasingly seen this trend towards more individually focused services and away from rigid entitlement-based systems. But I can assure you they're still there. And the question for most of us, I think, is whether this evolutionary process is indeed enough. And I think in my own portfolio, while we've been extremely proud of the sorts of changes we're making, we don't think these changes have occurred as quickly as we might have liked. In fact, I think we've been absent in the game for the last 5 or 6 years. And I think it is very easy for public services to keep doing things the way they've always done them, rather than to think and behave differently. And I'm constantly struck by the view that rather than embrace change, people want to be resourced to deliver something different. Transformation, in my view, requires not only structural change, but behavioural and cultural change, and a strong willingness for people to move. And I think this is what we have in the human services portfolio at this time, and hence my desire to push even more strongly forward with this kind of radical new paradigm. And certainly the community is impatient for this sort of change. The internet and almost daily new information technologies provide the potential for transforming our institutions in ways that were impossible before. To cover a bit of what's going on internationally, a Canadian academic, Dr. Kenneth Kernaghan, undertook a comparative study of international innovations in service delivery. And he observed that the international exchange of good practices in service delivery has had a major impact on service delivery improvements across the world. So, for example, New Zealand's Kiwis Count, a national survey of citizen satisfaction with public services, is adapted under licence from Canada's Citizen First surveys. As well as that, Malaysia's use of mobile devices for service delivery and the open government initiatives of the United Kingdom and the United States are developments that may well easily transfer to Canada. In Australia, we're looking for inspiration in what's occurred overseas, and we picked up the New Zealand model as the basis for a program that my portfolio runs with the Employment and Workplace Relations portfolio called Local Connections to Work, which is a very highly focused community-based support for unemployed people. Canada has also merged many shop fronts and integrated phone numbers and websites. We're doing the same thing. We're also doing things that they're doing around focusing on different stages in people's lives and bringing together the services around that. So, for example, when a family has a marriage breakdown, what do you do and what services do you bring in? In the initial work we're doing, we're finding these kinds of things actually save money, because what they do is prevent rework at our end, but also prevent problems getting worse at the community level. We're also expanding the sorts of services that we can deliver across the country by, of course, bringing Medicare services into Centrelink offices and vice versa. We've got mobile offices around the country, and we intend to take that further. At the time I stepped down as CEO of Medicare, we'd co-located about 50 services between Centrelink and Medicare. Within a few years, we'll have 570 offices that provide the full range of child support, Medicare and Centrelink services. Our initiatives are progressing quickly to enable citizens to do more work directly with us online, but that is hugely expensive and will take, I think, 3 or 4 years to bed down. We've established new forms of dialogue, as I said earlier, with service users, the community, providers, intermediaries, and that's going to help us reality test whether we've done what it is that people want to see. So what does citizen-centred service really look like? Well, it all comes down, in my view, to making things better for people. And hearing the sorts of stories that you can and do about the practical ways we can help people is really the reality check on the sorts of changes that we're working for in order to determine whether or not we are properly having the outcomes that the government is seeking. So let's take the situation of a family when it realises or has confirmed that they've got a child with a disability. Their immediate priorities are always about helping the child. They mightn't know where to turn first for service, and this is where a linked approach from our department can come into play. While we won't know all of the programs that people might require, we will have ideas about who does and who they should be able to link the parents with at their local level, particularly as that child moves through school. Now, while the parents are focusing quite rightly on the needs of their disabled child, we can help make sure that their needs are met too, such as through coordinated and streamlined access to income support or ancillary payments, Medicare rebates, referrals to respite services, or other programs that might increase their well-being. Now, by thinking and acting in terms of the needs of the entire family, the government can protect them from the kinds of financial and personal pressures that so easily and readily impact on relationships and their health. More often than not, or no, that's not fair. We see many cases, families with disabled children split, simply because the pressures are so great. And it's this sort of preventative and caring service that I think is really at the heart of what citizen-centred service is all about. And it shows, this example shows what an outside-in approach can mean for people and how collaborative services involving the government working together with the people receiving the service, service professionals and the third sector can improve public service delivery programs in ways that, or services in ways that rigid delivery programs could never do. By integrating sources of information around life events or local services and providing these kinds of warm transfers to other services, for those who've got quite complex problems, overall well-being is, in my view, absolutely improved. Now, to support this kind of approach, we're moving to embed what we call co-design principles in our operations. In simple terms, co-design is a systematic approach to understanding our customers and working with them to design, shape, or deliver better service. It's all about power, a transfer of power from provider to user. Transferring power also involves a shift in obligations and responsibilities, something that has to be negotiated between the public sector and the person receiving the service. To manage that kind of shift properly, we need to understand the people we assist and see the world and their lives as they see them. It follows that if service quality and effectiveness is to be improved in ways that focus on the citizen, then citizens have to do things too. With improved services and shared power comes shared responsibility for them as well. This extends not only to complying with the rules, but also to people changing their behaviour and accepting responsibility for the choices they make, including the bad ones. This approach is reflected in Australia's social inclusion policies, where one of our principles is a greater voice combined with greater responsibility